Stand by SOT1.
Standing.
10 seconds. Ready, roll in. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters.
It is September 27th. 2021, 12 noon straight up. Welcome to another edition of Work Comp Matters. We are brought to you by mancavepodcasting.com network. If you want to do your own podcast, all you have to do is talk anywhere around the world. All you need is a smartphone and or a computer. You talk right into it, put on Facebook Live, put in the mancavepodcasting.com cloud forever. We produce it for you. We manage it for you. We take care of all the hard stuff. All you have to do is talk. 818-357-4120, mancavepodcasting.com. Want to welcome everybody to Monday's edition of Work Comp Matters. My name's Steve Appel. I'm joined by the madman across the water, socialist voice of reason, Mr. John Scalia, with 40 to 45 years of experience in workers' compensation, employment, and labor law in Southern California, but now he's out in friggin' Munich, Germany, living the socialist life. Oh, well, everybody can't be perfect. Stories in the news today. Hang on really quickly. Wildfire smoke is here to stay. Here's how to clean the air inside your home. California's air pollution linked to higher risk of type 2 diabetes. Latino vaccine outreach appears to be working in San Diego. Hospitalizations among blacks soar in Los Angeles County. Assembly Bill 654, John has a story on that, passes California legislature and removes worksite COVID reporting laws. COVID outbreaks plague LAPD and fire agencies, data shows. Los Angeles police and fire agencies had over 200 COVID-19 outbreaks, and more stories that John and I believe interest you California employees, employers, and of course, we have not forgotten about you damn independent contractors. But there is a national story today, which I believe interests you employees, employers, and independent contractors, and it just broke a couple of hours ago. A federal judge ruled today that John Hinckley Jr. can be unrestrictedly released next year, more than 40 years after he shot then President Reagan in 1981. Hinckley was committed to St. Elizabeth Hospital for more than 34 years before he was released under certain restrictions in 2016. But if he hadn't tried to kill a president, he would have been released unconditionally a long time before that, U.S. District Court Judge Paul Friedman said. It was Friedman who allowed Hinckley out 5 years ago, determining that Hinckley's mental condition was in full and sustained remission and had been for more than 27 years. He had been diagnosed with a psychotic disorder and major depression. However, upon his restricted release from St. Elizabeth in 2016, Hinckley was required to live with his mother in Williamsburg, Virginia. He also was forbidden from having a firearm, contacting Reagan's children, or contacting actress Jodie Foster. Hinckley had been obsessed with Foster and had written a letter they intended to assassinate Reagan to impress Jodie Foster. So John Hinckley apparently is going to get his unconditional release. And this is the man, and will be fully released apparently in June of next year. Now, before I talk about this, I also want to give a piggyback story. This is from late last week. The United States in 2020 experienced the biggest rise in murder since the start of the national record keeping for murders in 1960, according to data gathered by the FBI for its annual report on crime. The Uniform Crime Report will stand as the other official word on an unusually grim year, detailing a rise in murder of around 29%. The previous largest one-year change was a 12.7% increase in 1968. The national rate, murders per 100,000, still remain about one-third below the rate in the early 1990s. The data is scheduled to be released today, along with a news release, but it was published early in the FBI's crime data. So 2020, largest murder rate in 60 years. Okay, now let's talk about that for a moment, and I'll go to Hinckley. What do you think contributed to the largest murder rate? Well, I'm going to say two things. One is COVID, because we know statistics tell us that most people who conduct murder people they know. They just don't go out and kill someone they don't know. Yeah, it happens. But it's a statistical fact that most people that kill somebody, they kill somebody they know. So COVID plays a role in that because it kept people inside. It kept people living together. It kept people from going out into public. But also, murder, of course, a lot of it doesn't happen behind closed doors. It happens in public. With the Black Lives Matters, the defund the police, there have been less police on the street, okay? And with less police in public, your murder rate is going to go up. This is a statistical fact here in the United States. Now, John may disagree with that for other countries, but I'm going to tell you right now, black and white, no gray. More police on the street, less murder. Less police on the street, more murder. I'm not talking about whether or not cops are good, cops are bad, there's police brutality. To me, it's simple. More police on the street, less murder. Now, that being said, let's go to Hinckley. In my opinion, if you attempt to murder a president, and in this particular case, Hinckley missed and he got Brady, and Brady had serious injuries, still does, has lasting trauma. If you attempt to murder a president, as far as I'm concerned, my tax dollars at the least are going to help pay for you to stay locked up for the rest of your life, okay? If you want to execute them, that's another story. I don't want to get into capital punishment. But if you attempt to assassinate a president, and in Hinckley's particular case, and again, he was released 5 years and he screwed up and he's back in, he should never, ever be released out to society for any particular reason whatsoever. Okay, those are my two stories to lead off Work Comp Matters. That's my rant. I'm going to go to the socialist voice of reason, also known as the madman across the water. John, take up to 5 minutes, or if we have to, we can go past the break and agree, disagree, tell me I'm completely nuts, I'm a little nuts, or God forbid, I shouldn't say, or heck, you agree with everything I said. Go ahead, John.
Well, I don't agree with everything you say. In fact, I hardly agree with any of what you said. First of all, I don't know where you got your statistic that there's less police on the street. Where does that come from? Because while all the rhetoric about defunding the police is there, none of it was to take any cops away from the street. Defunding the police was simply to allocate funds for different people to respond to mental health crises instead of armed cops. And so as I said from the very beginning of that, the terminology was really unfortunate. It never should have been called defund the police. That was stupid, in my opinion, and that's not what it does. What they call for is having mental health professionals to respond to mental health crises. So you don't have somebody having a mental breakdown, and as a result, they get shot because the cops are trained to respond to violence, at least in America. Okay. Secondly, I don't know where you didn't quote a single statistic saying that there's less police on the street. And besides that, what you pointed out to begin with indicates that police on the street wouldn't have done a damn thing about the murder rate. Because as you pointed out, the murder rate is a result of enforced cohabitation, the fact that people are in a confined space in their house, and that's where murder generally occurs. And I don't think you could have a law that says we're going to put a cop in every room so that nobody commits murder. That would be absurd. Okay. Now, as to Hinckley, well, it's problematical because obviously Hinckley is a bad case. But I would point. Oh, and by the way, I just can't resist saying this. We had elections in Germany yesterday. Merkel's retiring after 16 years of being the chancellor. And guess what? The Socialist Party won the election. So there. Yes, payday. The Socialist Partei Deutschland got most of the votes in the election, and they will be trying to form the next government in Germany. And Germany will not fall apart. Like all German governments, it will be a coalition, and they will have the Greens in there, whose main platform, obviously, as the name of the party implies, is to make sure that we don't poison the planet to death. And they will actually probably try to make an alliance with the Free Democrats, who are a very pro-business group. So Germany will continue to be an economic powerhouse, but it will be moderated by social policies that tend to be more green and tend to be more socialist. So, Hinckley is a bad, he did a bad thing. He's a bad guy. But again, there's no point in talking to an American about that. No offense, Steve. But, you live in a country where the criminal justice system is basically modeled on the Inquisition. I mean, the guy who committed, 20 murders in Norway, where he murdered all those mainly kids at a convention. I mean, he got sentenced to the maximum European sentence for murder, which is like 20 years. And in fact, he's going to college in his jail, which is, you can debate about whether that's appropriate. But the point is, America's criminal justice system is more in line with Iran, Iraq, the Soviet Union, not really a civilized system. So, yeah, I understand that Americans are going to be upset at what's going on with Hinckley, but in most of the civilized countries of the world, nobody would think twice about it. So, yeah, I disagree with what you said, and that's why.
And John, I'm going to backtrack on what I said, and thank you for pointing it out. I don't have any statistics, nor do I have what you or I would consider a credible news source to say statistics show that one of the contributing factors to the higher murder rate last year was because less police are on the street. I don't have those numbers. What I do have is credible sources from the New York Times, the Wall Street Journal, ABC, NBC, CBS, and Fox that do document that the murder rate rose between 30 and 35%. And they indicate that the year was marked by civil unrest, often triggered by police misconduct and leading to demands for police reform. But John, you are right. There are no statistics or reliable journalistic sources that say a contributing factor was less police on the street. So thank you very much for keeping me in check, sir. I appreciate that. That's why I continue to have you on the damn show. You're dialed in. Comp Matters. We are brought to you by the workcompcentral.com. Oh, that's right. If you want the #1 location for workers' compensation in both California and around the United States, check out the workcompcentral.com. They've got a free 7-day offer. You can pick up their services for $1 a day. Work Comp Matters is also brought to you by mancavepodcasting.com. 818-357-4120. If you want to do a podcast anywhere in the world, contact me, 818-357-4120, mancavepodcasting.com. And now, John, start us off with the news, bud.
Okay, this story is from CNN. It's FDA advisor called probably the worst drug approval decision in recent U.S. history for an Alzheimer's treatment. Dr. Aaron Kesselheim had been on an advisory committee for the U.S. Food and Drug Administration for a half dozen years. but he had never been to a meeting like this one. The FDA establishes advisory committees to assist the federal agency with one of its most important duties, deciding whether to approve the distribution of new drugs. The stakes of these decisions are enormous. Based on the outcome of the FDA's deliberations, patients may gain access to life-saving medicines, and manufacturers may reap billions in profits. Kesselheim, a professor at Harvard Medical School, was one of the members of this committee because of his expertise on pharmaceuticals that address diseases of the brain, including Alzheimer's, the irreversible progressive brain disorder that destroys memory and thinking skills and eventually causes death. Alzheimer's is the 6th leading cause of death in the United States. Now, they had a meeting, and in the meeting, here's what Kesselheim said about it to approve this new drug. There was a strange dynamic compared to the other advisory committee meetings I've attended, Kesselheim said. Usually there's some distance between the FDA and the company, but on this one, the company and the FDA were fully in line with each other in support of the drug. Dunn in particular was outspoken in his support for the effectiveness of the drug. From a regulatory perspective, drugs can work in 2 ways. They can work to treat disease, or they can address a surrogate measure for the disease. Now, most of the meeting was devoted to an analysis of Biogen's own studies of the effectiveness of Aduhelm. The results were not promising in terms of clinical outcomes. Indeed, 2 of Biogen's major studies of people taking the drug had been shut down before they were completed because they showed no significant benefit to patients. And it goes on. And the whole point of this article is that regulatory committees, and further on in the article, it points out that they decided that since this committee regulates drugs, the drug company should contribute to the committee. So they provide a certain portion of the budget for the committee. Isn't that great? You know, you're going to watch the hen house, and the fox is paying your bills. And so he quit as a result of this. And this article goes on to indicate that what's called regulatory capture, where people who are involved in the industry and it's somewhat incestuous end up on the committees that are supposed to regulate the industry. And this is what happens when the system goes amok. This drug costs $56,000 per month. And if it gets approved by Medicare, all the taxpayers in the United States are going to pay for a drug which has no proven efficacy, because apparently the drug industry has the FDA in their grasp and under their control. Steve.
And John, thank you very much for that. Next up in the news, Latino vaccine outreach appears to be working in San Diego. After months of dispatching neighborhood representatives door to door to educate residents about wearing masks, testing, and vaccines, there are signs their efforts are working. About 68,000 of eligible Latinos in San Diego County were fully vaccinated as of last week, county statistics show, compared to about 66% of Asians, 59% of whites, and 42% of blacks. John.
This article deals with the thing I was talking about in the episode I was talking about, where companies in California are striving to keep secret whether or not you're walking into a death trap. This is from the Sacramento Bee. California companies can keep workplace COVID outbreaks secret. Here's what happened. Supporters of a push to require companies to report workplace coronavirus outbreaks publicly say they plan to keep fighting despite recent setbacks that they say allow big businesses to keep outbreaks secret. In February, Assembly member Eloise Gomez-Reyes, Democrat San Bernardino, proposed the law requiring the California Department of Public Health to report COVID-19 outbreaks by workplace location, meaning outbreaks at specific businesses would be disclosed to the public. But that requirement was dropped from the bill's final version, allowing companies and public health officials to withhold coronavirus outbreak information from the public. Instead, health officials will report infections by industry. Worker advocates say this leaves workers and the public vulnerable and in the dark. You think? Once again, showing the power of money, basically, where private industry says, really, this is an inconvenience. We don't care what the benefits are to public health, so we don't want it. And guess what? The very so-called liberal legislature in California went along with that. Steve.
From the Los Angeles Times, Los Angeles County health officials have identified hundreds of coronavirus outbreaks at police and fire agencies since the start of the pandemic, according to data obtained by the Los Angeles Times through a public records request. The outbreaks, accounting for more than 2,500 coronavirus cases, have occurred in public safety agencies, large and small, across the county. More than half, however, were in just two agencies, the Los Angeles Police Department and the Los Angeles Fire Department, where members are actively fighting public health measures to control such spread. That's the story, and it's worth noting that 33% of our Los Angeles PD, 33% of our Los Angeles Fire Department, and 50% of our county sheriff's department have chosen not to be vaccinated against COVID-19, either for medical reasons, religious reasons, or unknown reasons. John.
Well, I'm going to go back to that. We're going to go back to one of my favorite topics, how religion dictates what you should do for your health and how you should dress and everything else about your life. Nearly 200 on SF police staff want religious exemptions from city's COVID-19 vaccine mandate. Did you know that your cops were that religious? Nearly 200 members in the San Francisco Police Department have applied for a religious exemption from the city's employee vaccine mandate, the highest number of waiver requests from any city department by far. About 91% of the city's 35,000 person workforce is fully or partially vaccinated, but 2,700 or 7.7% have not been vaccinated. 1.4% have not reported their status. In the 2,835 member police force, okay, that's the size of the police force, which is much smaller than the LAPD. 366 employees are unvaccinated. You'll notice that's well over 10%. Of the unvaccinated, 193 want religious exemptions and 8 have requested medical exemptions. The others have not requested any waivers. It is unclear how many of the unvaccinated police staff are frontline officers and how many work in administrative roles. Now, these are all people that have contact with the public. Obviously, this is clearly a public safety measure, not only for them, but for the public. Protecting and serving, yeah, right. We'll serve you up a virus. Thank you very much. It's just unbelievable. For those of you old enough to remember the draft during the Vietnam War, let me suggest something. During that time, you could request a religious exemption from serving in the military. But you really had to prove it. You had to show the draft board that it really was based on good faith and on your good faith belief that you could not participate in a war. And I really wonder, there's never been an accounting in any of these stories about what these guys actually have to do to show that their religious exemption, quote unquote, is actually based on good faith and that it's actually not something they came up with at the last minute. Wouldn't it be nice if somebody would report on that? And wouldn't it be nice if there was some transparency in the great transparent democracy of the United States of America? Yeah, Steve.
And John, I'm going to stay on that for a moment because some of you listeners may remember a gentleman by the name of Cassius Clay, who renamed himself Muhammad Ali. He objected going to the Vietnam War, I believe mostly based on religious reasons, but essentially he said, I'm not going 12,000 miles to fight the Viet Cong. They never called me the N-word. They never came to my neighborhood and harassed me, my family, or my friends. If I want to go ahead and kill somebody, I'm going to stay right here. And of course, he lost his boxing license. It went all the way up to the United States Supreme Court. And I don't know the official terms, but if they pardoned him or whatever, I'm not sure. But I also wanted to say that I have not seen any evidence whatsoever that anything in someone's religion, whatever their religion is, prevents them from getting a vaccine. And I find it interesting that our law enforcement officers, our police men and women, have a religious objection to getting a vaccine, but not a religious objection to going out on the street and killing somebody with a gun, regardless of it being in self-defense or whatever the case may be. So, John, unless you want final word, I'm going to go to our next story. All right, very good. No, did you want a final word, or should I just go to our last story?
No, go to your last story.
You got it, sir. From the San Francisco Chronicle. In most San Francisco neighborhoods, there were fewer coronavirus cases during the summer's Delta-driven surge than over the winter when cases peaked in the city. But a few neighborhoods, primarily young and affluent ones, actually had worse case rates over the summer, according to a Chronicle analysis of the data from the San Francisco Department of Public Health. We examine cases across every San Francisco neighborhood across 2 time periods: the period between December 15, 2020 and February 15, 2021 during the city's winter surge, and then the period time from July 1 to September 18th of this year, soon after the city lifted most coronavirus restrictions, and the Delta variant caused a citywide surge in case rates. What can I say? That's from the San Francisco Chronicle. And you just got to be careful out there. Use common sense. Do your best not to do anything stupid, whatever that may be. And of course, what I choose not to do in my life is probably different than what you choose to do or not do in your life. John, we got, a minute or 2 left. You can give us any closing thoughts or burning desires.
Well, the last story I was going to read is about California banning state travel to Ohio and a bunch of others.
If it's a short one, go for it.
Well, California is banning state-funded travel to Ohio over the state's new law allowing doctors to decline medical services to people on moral or religious grounds. Yep, does that sound familiar? And it talks about, the Ohio law, the Ohio measure triggered a 2016 California law that requires the Attorney General to prohibit state-funded travel to states that discriminate against LGBT transgender, people. The interesting thing is that, this is not a one-off. The article goes on to mention, here's the following states that have similar laws. So California state will not pay for state employees to go to these states. Arkansas, Florida, Montana, North Dakota, West Virginia, Alabama, Idaho, Iowa, Kansas, Kentucky, Mississippi, North Carolina, Oklahoma, South Carolina, South Dakota, Tennessee, and Texas. Bet you didn't know you lived in a theocracy. Yeah, okay. That's all I have to say about that.
All right, very good. And that'll about do it. You've been listening to Work Comp Matters, and we thank you very much for Scott Walton of legendary Uncle Studio, John Scalia, Madman Across the Water, Socialist Voice of Reason. In addition to all the good people back at the workcompcentral.com and mancavepodcasting.com, my name is Steve Appel. We'll see you again Friday, 12 noon live for another edition of Work Comp Matters. Bye, everybody.